and when they fail to do so, we think that's then when it's justified for us to intervene. We think legal guardians are there to help children become autonomous agents, but if the scar and mark of the decisions hurt them for life, that's where it's imperative for us to stop. We think that when there's no objective way of deciding certain things, say the personal values of a child, say that of humility or discipline or outlook to life, whether the bottle is half full or half empty. The parents certainly have autonomy in this view of upbringing. But when there's a more objective standard, where the child's life is at stake, say for Jehovah's Witnesses, when they need blood transfusion, we think these are very clear circumstances in which medical science can triumph over individual beliefs of parents and their conception of what is good for their children. We think just an extension as to why we impose certain things, such as compulsory education for the children. We believe that we really recognize these precedents as to why the state's priorities can triumph over the parents' ideas. Because generally, insofar as the objective standard which exists in medical science, when there's net benefit that can be weighed based on precedents, we think that is when the parents must see their stakes to the state to decide what's best for the child when it cannot do so. So what does our policy do? Our policy does several things. Firstly, the state will bear the cost of healthcare until age of consent, generally 18 for most states. This means that this is different from how the status quo is, whereby the consumer usually pays on demand and bears a greater degree of cost. We think this debate then takes place in first world countries with sufficient infrastructure as well as financial capacity to do this. Of course, we mean that the state can consult the parents and the child when making their decision, or vice versa, but ultimately the state is still the ultimate stakeholder in deciding the decisions in which the child can do. So this will be then determined by a board of medical professionals and independent bodies to help facilitate decision, which is pretty much the status quo in medical science. We'd like to clarify that also for post-medical treatment services, say for kidney dialysis, of course this can then be sponsored by the state as well. We'll continue to fund these things. So what circumstances do our policy exist? We need to understand the spectrum of parents that we're talking about. For those that have absolute faith in the services of the state and believe in medical science, obviously that's not end of spectrum we're concerned with. We're concerned with moderates, those that are stubborn conservatives, say for religious reasons or say for personal reasons, because they love their child so much and they believe in an extremely narrow conception of welfare that they want to take these into their own hands. We think when we analyze the decision-making calculus of parents, we need to understand that parents are generally extremely risk-averse, especially when it comes to their own flesh and blood, because they fear the prospects of the child never waking up again. They fear the child being kept as a vegetable for life in a vegetative state. For things like facial cancer, first-stage cancer, this is extremely irrational, because when there's only barely 0.01% of neural damages to synapses, which renders permanent paralysis, the parents often overlook this and emphasize the risk because of pessimism bias, because they fear that they actively hurt their child, and this emotional burden hinders them from making clear, rational decisions that will help the child in the long run, because they fear that their son or daughter will never wake up again, and this cripples them from making the best decisions for them. We think the degree of closeness that makes them extremely irrational when they're able to weigh the net benefits and harms. Why is the state then better able to do this? The state is more emotionally detached for good reasons. You can make better risk assessment because they have knowledge of track records and more nuanced understandings of the body. Say for organ rejection in terms of blood type as well as the kind of body you have. The state has better specialized knowledge in this field, and this often triumphs the kind of layman ideas that parents have. Sure, they can care for their children, and we acknowledge that. But in this field, when the life of the child is at stake and the parents aren't able to make clear decisions, we think it's extremely imperative that the state comes in. If I move on, yes, sir.
Don't you think the state also has a vested interest to maximize resources that sometimes can outweigh the right of the child?
So we think maximizing resources comes within our paradigm as well, because there are long-term consequences if the child is harmed. That's why our policy is imperative for two reasons. Because these these medical decisions often affect the long-term future of the child, which is pretty much our next generation. We think it's extremely important for the duty of the state to interfere in this. We understand this extremely imperative in medical science because the window of opportunity is extremely low. When first-stage cancer develops subsequently, very quickly, rapidly into terminal cancer, that is when we recognize that the window of opportunity has collapsed. Why are parents often unable to act within this window of opportunity? I already explained why the emotional burden always hurts the parents. They are always so concerned about how they can lead these lives, and all these things affect the way they can make quick decisions, swift and decisively within the short span of time, and this warrants urgency. When the state is able to recognize the urgency and implications of medical decisions, they are better able to safeguard the prospects of the child when the time calls for it. When time is of the essence, we think the state are better actors because they are not weighed down by all these emotional concerns as a result of the intimate relationship between the parent and the child. We think it's also important in the case of religion because by and large, we think parents, we need to recognize that many things are stopped. I explained blood transfusion in terms of Jehovah's Witnesses, also things like circumcision. We think when the parents impose an irreversible identity that affects you permanently, we think it's imperative for the state to step in to consider the interests of the child and for these things to feature. Because ultimately, the locus of life should not artificially determined by the parents. People should have a stake in this. Parents, children should also have a stake in this. We think state actors are best because they are detached. They are able to weigh out the implications on the child rather than having artificially extremely biased views that clouds judgment, that hinders them from making a good decision for the child. Because ultimately, we think love works in some circumstances, but love is unable to save your life when medical science is the reason for sustaining it. We have to talk about things like vaccination, hepatitis A, hepatitis B, stuff like that. Religion often hinders them because of various conceived bias. Like say, certain vaccinations are likely or urinated. These things hinder good judgment. We think we better help balance love for the child and their long-term interests.
I find the Prime Minister speech one of the keys for constitutionally valid here.
Madam Chair, we think that the state can only intervene when parents actively demonstrate negligence towards the care of children with Chair. And we think this is important because we recognize that the state needs to strike a balance within preserving the right of parents to dictate what's good for their children and also at the same time protecting a minimum standard, Madam Chair, of healthcare for children, Madam Chair. So we argue that the state has an important duty to provide that minimum standard, right? Children must not be actively harmed or have any irreversible damage. But beyond that, Madam Chair, we think the decision-making process of what healthcare is best for children should be ultimately left to parents. What will I talk to you about in my speech? Firstly, we'll discuss the relationship between the state and parents vis-a-vis children. Secondly, I'll tell you why this right to parents, the right to afford the autonomy of parents within the large spectrum of decision making in healthcare is particularly important. And lastly, I'll talk to you about the best way to change these traditional conservatives like the Jehovah's Witnesses with regards to their practices that are harmful to children, right? But before that, let's deal with some rebuttals because they told you that parents need to seek autonomy in certain cases. Yes, we agree, Madam Chair, and that's why the principle is that those certain cases require parents to demonstrate that they are actively harming children by the way they have been treating their children, right? That means they have to actively fail the standard of duty of care, Madam Chair, and that's why they intervene. They are punishing parents who have not done anything to fail the duty of care. Even the best parents, Madam Chair, have to be subjected to state intervention. We think that is incredibly unfair. Secondly, Madam Chair, She told you that parents can be irrational or be risk averse, right, Madam Chair, and therefore be unwilling to undertake important treatment, Madam Chair. But we argue to you that that argument works both ways, right? The threat of a life to my child will also make me risk averse and want to pursue treatment, right? So that works both ways. But more than that, Madam Chair, we think that it's harmful to say that the state is the best actor to decide, because under status quo, we think there are already multiple parties in charge of the decision making, right? You have parents, you have doctors who are neutral and independent who can consult parents also, right? And even the worst case scenarios, state can also intervene with regards to taking away children who've been provided bad treatment for them, right? So we think the existing status quo of check and balances already work fine. We don't think that you need to have the state to always intervene in every single circumstance. But more than that, Madam Chair, we also argue that states has a vested interest to maximize resources, right? What does that mean? Because they put a drain on state resources because they say the state needs to fund all the treatment of everyone who's going to, so all these children who are going to suffer. What does this mean, Madam Chair? Is that given the scenario of limited resources, the state will prioritize, Madam Chair. What does this mean is that if I'm a private citizen with the funds to give the best healthcare to my children, I can't, because the state is going to dictate what healthcare my child deserves. We think that's incredibly harmful to an individual's right to decide for themselves, right? Yeah. Moving into before our argumentation, let's talk about status quo. We think in status quo, right? If you reject or deny access to healthcare to your children, we think doctors, social welfare can intervene, right? We think that's particularly great. We think, especially with regards to cases going to family court, which can adjudicate quickly if time sensitivity is an issue, right? If there's active harm, right? The child protection services intervene and isolate the children temporarily, right? We think those are, and give them necessary treatment. Those are great, right? We think we think the yardstick ultimately for when to intervene is based on the foreseeability of harm and injury and the magnitude of the harm and injury, right? So the difference on both sides, Madam Chair, is this. On our side, we tell you that there should be a presumption of competence on the part of parents to carry out their duties, Madam Chair. They ignore this presumption and they assume that all parents require this intervention. We think that's bad. First argumentation. We think the relationship with the state and parents, as with respect to the parents' patriarch doctrine, means that the state can only act against abusive or negligent parents, right? That means the parent needs to actively demonstrate that they're causing harm. But secondly, Madam Chair, we think this is a presumption of innocence or presumption of competence. Why do we afford this presumption, Madam Chair? Because we take away important legal rights, Madam Chair. There has to be a balance, Madam Chair. You can't willingly take away the right on the presumption that you will be a bad actor in exercising that right. That's why we allow for a presumption of innocence in courts, Madam Chair. I think that's particularly important. But thirdly, Madam Chair, we think the duty of care acknowledges also two important aspects, right? Firstly, the importance of the social value of the actor, which is the parent, and also the usefulness of the conduct. Given that the parents are important actors in providing the healthcare of children, providing welfare of children, right until they're 18, we think that given that they have this important stake, we think it's important to recognize their right also. But fourthly, Madam Chair, we think the state needs to recognize that there's a minimum standard and protect the minimum standard, Madam Chair, which means they have to ensure that the burden for healthcare is solely on the parent with regards to the rest of the spectrum, Madam Chair. I think that's particularly important. But secondly, Madam Chair, why is the right to parents particularly important? Yeah.
If you acknowledge that parents can screw up, why is it that we wait till the harm is manifested on the child before we intervene, when we can easily review the decision?
Great. I'll tell you this why now. Because there needs to be a balance in status quo, Madam Chair. Because the right is very important, right, Madam Chair. You cannot waive that right away on the assumption of the minute possibility that they will cause harm to their children. Why is this right important? Number one, because we think the upbringing of children and the resultant imparting of values is also intertwined with the kind of healthcare choices you make for your children, right? We think that's particularly important because the kind of healthcare you make for your children also reflects the kind of values you have as an individual parent, Madam Chair. But secondly, we think there's also a power dynamic within the relationship of the parent and the child. The child is to respect parents with regards to assuming authority is at the hands of the parents with respect. We think the government assuming authority on behalf of parents is incredibly harmful. But thirdly, we think there's also a breach of privacy, right? We think the relationship between parents and children are deeply personal. And we think this kind of policy of intervening at various points in the children's life are incredibly traumatic. We don't want to allow that to happen. But lastly, Madam Chair, what is the best way to change the traditional conservative mindsets, right? We think when parents who are Jehovah's Witnesses
cause the death of their children as a result of their practices. It pushes the debate about those practices out into the open, Madam Chair. This is incredibly important because the only way we're going to debunk and delegitimize this practice is if we see the harms of this practice manifest themselves. We regretfully acknowledge that means there will be a group of children who will be harmed as a result. But for the long-term benefit, Madam Chair, of debunking this practice, finally, Madam Chair, we think it's particularly important because all they do is they push the discourse and they radicalize these groups to disengage from governments and to keep their family unit hidden, Madam Chair, and disengage from government. But it's incredibly more harmful because the state cannot be there all the time, Madam Chair. The state has to allow parents to make decisions for the children and respect the rights of parents to do so. What have I told you today, Madam Chair? I've told you firstly that the relationship between state and parents requires the presumption of competence and requires parents to demonstrate first harm before they intervene. Secondly, I told you why the right to the parents is important with regards to the autonomy. And thirdly, I told you what is the best way to change the traditional conservative mindset. The things allowing this debate to happen in the open, not pushing it further. And we're very proud of those.
I think leader of opposition that speech to continue to use the recommended programs.
The logic of side opposition was this, that in the status quo with regards to other respects, we allow parents to first harm their children through their active negligence or abuse before we decide to step in. And that this, at best, all they will offer these children is their regret and remorse. We don't think that that's good enough, because we told you that these decisions can often have irreversible damage on the lives of these children. We think that the cost is often borne by these children, who are also independent citizens to whom the state owes a duty, disjoined from their duty to their parents in terms of respecting their locus parenti. But we also think, moreover, that in terms of the kind of decisions that parents make, we explain to you how parents routinely fail their children in terms of the kind of risk calculations that they make. That they routinely make decisions that are not often in the best interest of their children because of the same stake that they have, because they don't want to risk the emotional hurt that might accrue to them. The fact is that parents insert their emotions into the calculations which they make when they decide whether to undertake an operation that may have certain risks. They are much more risk averse than they should be, because they also consider their own emotional hurt and even the worry that they have to undertake if the outcome isn't what they want. So they're not just thinking about the child, but they're also thinking about preserving their own psychological state. And we think that's unfair, because they tend to prioritize that more than purely thinking about what's in the best interest of the child. We think the state and doctors only consider the patient and not the emotional hurt they've done to parents, and we think that that's the way to go. We also told you that there's often irreversible damage that's done because there's a short window of opportunity. So when diseases that can potentially become widespread within your body and can have long-term consequences, you can often remove these diseases by undertaking surgical operations now. But the fact is that parents also consider whether they want to take the risk of surgery, which yes, we can see in some small number of cases might result in irreversible damage or even death, versus the fact that would they be okay with maximizing their time with their child. Even if their child has to suffer, the fact is that they might be able to have their child for a longer period of time. Now, what if they had to compare the fact that the child might die in this operation versus the fact that yes, he may live for a shorter period and a more debilitated life, but yes, they might have more time with their child. We don't think this is a fair calculation to make, and we think that losing that window of opportunity is a clear instance where parents fail to make that best decision, and their side's decision to wait for harms to become worse unfairly burdens the child, because we lose that window of opportunity. We told you that the government should have a veto over your decisions, but of course they said that look, resources are constrained. So obviously, if rich parents wanted to fund care for their kids in the best hospital around the world, and the doctor said that this is the best chance that your child has to survive, and the parents are willing to fund it, we don't see why the state would stop them from doing it, because the state's interest in maximizing that child's ability to survive. So if your own doctors aren't good enough and someone else's are, and the parents are willing to fund it, we see no reason why that's a problem. But we also told you that we would set this debate up in places where there are well-established healthcare systems, where you don't have this kind of private-public divide, where public hospitals lack funding, don't have adequate healthcare capacity, and so these children would suffer a poorer standard of care. For us to be able to have this debate, you have to assume that your government hospitals hospitals are not shit,
Sir.
and that there is a certain standard, a certain minimum standard, as you wanted to debate, would be accorded to these children. The question then that needs to be asked is, will there be enough state funding? We think that the healthcare costs for children are largely minimal. The most expensive things are often things that require chronic treatment. So things like heart disease, things like obesity, things that require regular regimens of treatment and perhaps even regular procedures. We think firstly, given that we maximize the window of opportunity to cut these diseases out early, we reduce the healthcare cost for the state later on. The secondly, we also think that the cost of taking care of children is often less because diseases aren't as well developed as they would be in adults. So the cost of treatment or the complexity of that operation is a lot less now. So if they're worried about state funding, we think we minimize it both in the long run and even in the short run in terms of the cost of taking care of kids. It isn't as they would like you to believe. They then wanted to talk to you strangely about values that are related to healthcare. We think that there are objective standards when it comes to deciding whether your child will live or die. We don't understand what these values are. If they want to talk about distrust of the medical profession or whether surgery really works or different subjective conceptions of what a good quality of life is, we already told you that the parents don't take into consideration their child first and then their own emotional hurt. And the fact of the matter is that whatever